Hi, everybody. Welcome, welcome. Okay, I see a couple people still joining, but it is 5:30, so we're going to go ahead and get started. I'm going to share my screen as soon as my host allows me permission to, and we are going to, you should be able to see my presentation in just a moment, and there it is. Give me a heart if you're able to see it. All right, very good. Okay, so today I am welcoming you to Full Circle's orientation webinar. We're going to go through what it's like to go through a pregnancy with Full Circle. This is something I do twice a month to just kind of to do a little level set some expectations about care and about the care that you're going to be provided here with us. So this program is confidential. So if you ask me questions, I can see who's asking, but I won't say who you are or anything so that anyone else can find out who you are. So feel free to participate. I'll ask some questions. I'll say, give me a heart or a thumb or a thumbs up, something throughout here to just make sure that we're all still engaged. And if you have to hop off at any point, just remember that this presentation will be available on our YouTube channel for the duration of your pregnancy. So things we're going to go over today include the full circle experience, which includes where we deliver. We'll talk about some office protocols, go through what to expect at each pregnancy visit, going to give you a ton of prenatal resources. I'm going to go in depth about exercise and nutrition in pregnancy. And then finally, we'll wrap with an update on upper respiratory illnesses. So let's start with the philosophy of our practice. The collaborative midwifery model starts from the belief that pregnancy is normal. This is pregnancy and birth are normal life processes. It's not a disease we have to cure you from. But the traditional midwifery model also follows the same philosophy, but in caring for low risk women. If you develop any risk factors, certain problems with during your pregnancy, you'd have to transfer out from being able to see midwives for your delivery in order to access physicians for your care. In the collaborative model, physicians and nurse practitioners and midwives all work together so that you can still have the midwife delivery after we've taken care of all the things in the office to optimize your prenatal health. So, to that end, most of our labors and deliveries are attended by our certified nurse midwives, either our our hospital crew, or we have some who are in the office and the hospital. If there's anything that's outside of the midwife scope of care, they call us. So physician consultations, if it's urgent, that's something that needs to happen but cannot wait or be scheduled. Most of us are usually about 15 or 20 minutes away from the hospital, and they call us in, and we come in and do whatever it is they need us to do. If it is an emergency, meaning you don't have 15 or 20 minutes, there are board certified OBGYNs who are in-house at the hospital 24 hours a day. And I think at the beginning of this, you were seeing our stats. So, 2 years ago, we did a little over 600 deliveries, and we used the hospital services 4 times. And only one of those times was like a physician required. So 3 of the times that we used them, it was because somebody showed up 10 centimeters and didn't have time for someone from our office staff to get here. We've actually pretty much eliminated that because we now have hospital staff, so hospital midwives who are there 24 hours a day as well. So we won't miss any deliveries. And where is all this wonderful magic happening? At HCA, which is less than 10 minutes away from our office. We have been there now going on 3 years, and it's been an excellent move in terms of the support of the administration for belief in the midwifery model of care, to the extent that the hospital has actually partnered to ensure that we have 24-hour-a-day midwifery care as well as physician care in-house. So yay, HCA. If you would like to see HCA, we encourage it. There are stork tours. The next one coming up is August 20th. These occur quarterly. We may have to get more because they're always full and sold out. But if you're not able to register for the one in August, there's another one, I believe, in November. But if you can't make it to any of those, if those days don't work for you, in between, you can go onto the HCA website and click on register for a class, and then the class is labor and delivery tour. We do those. One of the childbirth educators at HCA does those every 2 weeks. You just pick a date and register. Those are small groups. She takes like 10 to 15 people at a time. The office, Full Circle, is open Monday through Thursday from 9 a.m. to 1 p.m. We close for lunch between 1 and 2, and then we reopen at 2 and we're open until 5. When we close for lunch, the phones roll over to the after hours line. The reason we do this is because the line rolls to the emergency on-call person who's in the hospital. So if you have a medical emergency during lunch, you can still reach a medical provider. So you have to leave a voicemail in order for her to see that the call comes through. But don't leave administrative messages between 1 and 2 because again, she's the emergency on-call person. So she's not calling the office at 2 o'clock to give the other messages. If you're going to be late for your 2 o'clock appointment, just call us at 2 and you'll be fine. We're open on Fridays from 9 to 1. So if you're calling with something administrative at 12:50 on a Friday, it may have to wait until we reopen on Monday at 9 because again, the on-call person who starts at 1:01 on Friday for sure doesn't schedule appointments or refill prescriptions or things like that. We also do not have walk-in appointments. Our goal at Full Circle is to see you at as close to your appointment time as possible. And if we promised you the 2:40 space on a Tuesday and somebody decides at 2:37 that they are walking in to be seen, it is not fair for us to push your appointment back. And you've made an effort to get here on time to see us. It's not fair for us to push your appointment back for a walk-in. We do have some same-day appointments. So people cancel, reschedule, deliver, all of these things, and appointments come open. If you're calling and saying, hey, I would really love to be worked in for this today, and someone has an opening on that day, then we'll try to put you in that spot so that we can see you at a predictable time. We don't want you sitting in our lobby waiting for someone to, miss their appointment so that you can then get worked into the schedule. If it is something urgent, like say you're calling at 9 in the morning saying, oh, I don't feel my baby move, and our only open appointment is 3 p.m., we're not going to have you wait 6 hours for us to check on your baby not moving appropriately. That's an urgent matter. So our recommendation will probably be you need to go to labor and delivery to get checked out. You got chest pain, shortness of breath, we're going to send you to the emergency room to get checked out. That's an urgent matter and also should not be waiting 6 hours to get in or sitting in our lobby waiting to be worked in. When you call, the providers are not able to leave patient appointments in order to take phone calls. So you can't say, hey, I want to talk to Dr. Adams. I'm probably seeing patients. So the staff knows how to take messages for us or direct you in how to reach us individually. When you call, be sure you're leaving a message with the right person so that you get the fastest response. So, for example, if it's something administrative like FMLA, disability, that sort of thing, Jennifer and Kylie work between the two of them to get those two things together. If it is a triage call, so if you're calling with, I'm spotting, is this normal? I'm cramping, is this okay? They also are the ones who are going to talk to you about that. Naisha is our OB clinical coordinator. So some of you have already had some contact with her because she's the one who makes sure that all referrals go through, labs are ordered, and then at the end of pregnancy, she's the one who helps with scheduling. So do you need an induction? Do you need a C-section? Do you need a version? Does your baby need a circumcision? Naisha is your girl for scheduling all of those things. And then most of you have already met Renee Hall, who is our benefits coordinator. She's the one who's not Tiffany from the video you watched in the room. So she's the one who's keeping up with insurance stuff. If anything changes with your insurance at the end of the year, you want to let Renee Hall know so that we have your new benefits and we're able to continue to file appropriately. After hours, there is always someone on call for our practice. So this is who you call if you think you need to join them in the hospital. So this is, again, the phone doesn't even register that you called unless you leave a voicemail. So remember, when it prompts you to leave a voicemail, if you call and hang up, there's a program on the phone that it won't even show that a call came through. Another way to reach us is the patient portal, but remember that response times can take 2 business days. If it's a non-action item, like just wanted you guys to know this, that, or the other, we might not respond to it because you just wanted us to know. They may just send it to the next person who's going to be seeing you in the office. Or if it's something like, oh, can I take these vitamins? Or, what supplement do you prefer? Again, that may be something that we answer at your next prenatal visit because it's not urgent. It doesn't have a quick turnaround time. Things that if you lost your lab slip, you need to go to the lab. You need a lab slip so that we can give it to you so you can get something done. The portal is best used for things like that. Or you have an upper respiratory issue and you can't come in, you want to change your appointment to something virtual, let us know. As long as there's 2 business days between when your appointment is going to be, otherwise we want you to call. Please don't use the portal for urgent matters. Because remember, 2 business days. If you're at home with high blood pressures, not feeling your baby move, bleeding, those are things we don't want to see on the portal because, again, 2 business days. If you send me a message on Thursday that you're not feeling your baby move, I might not see it until Monday because the next business day is the Friday and then Monday. We also ask that once you've sent a message, you're saying that you have 2 business days to wait. So please don't cut and paste that message to each one of the providers. One time someone was upset. She went to the pharmacy and there were 5 prescriptions waiting for her for the same thing. Which one do I take? Well, you messaged 5 people and we all want to help. So the better use of our time is to message one person. If you get to the end of your 2 business days and you have not heard back from that person, yes, absolutely message someone else because, yeah, people go on vacation for sure. But if you get to the end of that 2 and you're like, I don't want to wait 2 more business days in case someone else can't answer me, then please call because we do want to address what's happening with you. And we also ask that you don't try to have an appointment over the portal. So appointments are things like, I've uploaded all these labs. Can you go over the pros and cons of these different treatments that you've recommended for me? That's an appointment. So we'd like you to schedule an appointment or text yourself questions and bring them in for your next visit so we can go over it with you in real time. Because again, instead of going back and forth over the next 12 business days for a question that we could probably answer in the office in 5 minutes. We also use the patient portal for ultrasounds. So if there is something urgently abnormal, though, about the ultrasound that you have done in the office, we won't let you leave the building without going over it with you. Otherwise, we don't get the report on the same day. So at the end of the day, our techs complete their report. The medical assistants take it off of the ultrasound machine, upload it into our EMR, and then divide it among the providers to review and send out to you. So it's sometimes 2 business days before we are able to send them out to you. So give us a chance to receive the report, review it, and release it to the portal. Quest and Natera also have patient portals too, where they send your results out at literally the same exact second that they send them to us. So if we haven't had a chance to see the results first, please don't see your results and then start typing messages. What does this mean? I've already Googled this. I think I have this. Can you recommend and treat me with that? Give us a minute. They might send the results to you before we get a chance to see them. And then sometimes you see red on the paper and you think, oh my gosh, everything's wrong. Red doesn't necessarily mean abnormal. The reference ranges that they use for the labs are for people who are not pregnant. When you're pregnant, there are some physiologic changes that change the parameters of what's okay and what's normal. So give us a chance to receive the labs. Don't upload them to your portal because we need to get them from the lab. Give us a chance to receive them, review them, and send them out to the portal. 9 times out of 10, there'll be a message there saying, hey, even the ones that say that they're out of range or abnormal actually are just fine. Now, if you've had the labs for a week and you haven't heard anything from us, then definitely let us know, hey, I did these labs and I don't see the results. The most common reason that we don't get labs or reports from other physicians is if you're using a different name at each facility. So name consistent, like if you're a Smith in your heart, but you're a Jones with your insurance company because you haven't changed your name yet legally after marriage, just know that whatever your name is with your insurance company, that's what we like for you to use. Because also, we don't have a fax machine here. Everything goes to Massachusetts to a hub and gets sorted out by name, date of birth, and all that stuff. So if your name doesn't match, your results coming in do not sort into your chart. So, any questions about contacting us? Cool. We're going to move on to what to expect at each prenatal visit. So, first thing, expect that you are going to forget all of your questions as soon as you hear your baby's heartbeat each time you come in. So, start a text thread with yourself. I did some visits today and it was really sweet and heartwarming to see people say, I do have questions, and pull out their phones and start going through the questions that they brought. We will be listening to your baby's heartbeat each time. We're not doing an ultrasound each time, but we will be using the Doppler to just hear the heartbeat. Like, you should be reassured every single time that your baby's heartbeat sounds good. So, wear loose, comfortable clothing so that we can access your belly. Rompers are very popular in the summer, but sometimes it makes it really difficult to get to the belly. So, a shirt you can lift, and a little belly band pants that you can push down so you can get to your belly. We'd like you to get here about 5 minutes before your scheduled appointment time so that you have time to check in. And if you need to leave a urine sample, do that. We used to get urine samples on everybody at every visit, but the American College of Obstetricians says we no longer need to do that. So you'll know if you need to leave one. Front desk will tell you, because it's either you've had high blood pressures and we're looking for protein, you've had high blood sugars and you're looking for glucose, or you've had a recent urinary tract infection and we're making sure everything is cleared up. If you're 10 minutes late for the visit, we do still have time to check on you and your baby, but obviously it leaves less time for our little text thread conversation. If you're 20 minutes late, then we've missed the entire prenatal visit, and we may be able to work you in some of the appointments that are already open later in the day, or if none of those times work, we can reschedule to a day that works for everybody. So, diagnostic ultrasound visits are separate from your prenatal visits. We all had a fun time looking at our baby for the confirmation ultrasound. But how do you know when you have another ultrasound coming up? So, we'll typically do your anatomy ultrasound right around 20 weeks or so. And the way to know if it's scheduled is to look in your portal. So, do you have more than one appointment time? And is there a provider's name associated with your visit? This is Tina Test, my imaginary patient who's been with me since the practice started. Tina logs into her portal and clicks on appointments, and she sees she has 2 appointments on the same day. So her first appointment is at 9:20 with ultrasound, which is not a provider's name. Her next appointment is at 10 o'clock with Dr. Yeckel, which is a provider's name. So Tina knows she's got an ultrasound she can bring her family to, and then afterward she can meet with Dr. Yeckel. So if you know that you're not able to wait for 2 business days to find out what was on your ultrasound, schedule an appointment on the same day, because the techs can print out a preliminary report and give it to the provider who's seeing you, and then she can go over it with you. So Tina will get her ultrasound, and then at 10 o'clock, Dr. Yeckel will go over a preliminary version of the report, and then she'll get the full report on her portal within 2 business days. So remember, that's when we will send those results to you, unless there is something urgently abnormal, in which case we will discuss it and make a plan on that same day. When you're checking out of your visit before you're due for an ultrasound, let the front desk know to make sure you are scheduling 2 appointment times on that same day, or an ultrasound and another prenatal visit on a different day. If you would like to look at your baby more, then medically we actually need to. There are boutique ultrasound places all around the city. These are just a couple for informational purposes, but they do all sorts of cute stuff like 3D, and then they'll put the baby's heartbeat in a stuffed animal, and you can bring your whole family, and they do sneak peek packages to see if it's a boy or girl as early as like 14 weeks. So just know that these places are out there. All right, so we are going to scoot over right now to the website. So let me know if you're able to see Full Circle Jacks as the website. Give me a heart or a thumbs up or something there. Okay, fantastic. All right, so let's start with the people. And this, I'm excited because we have a brand new website. So this is y'all are the first webinar that I'm doing with the new website. So we'll start with the physicians. So if you hover over our lovely faces, you will see the names of the different physicians here. And then you'll see down here, these are the midwives and nurse practitioner who will be taking care of you between the office and the hospital. And so you can read our bios by looking on each one of those. Over here on the obstetrics page, you will see a bunch of different tabs. So our delivery statistics, the show that you were watching as we were waiting to start this, has our statistics, had our most recent ones, but this has our information back to 2018. So you're welcome to find out. If I'm a first-time mom, what's my chance of ending up with a C-section? I had a C-section before. What's my chance of getting a successful VBAC? So in your free time, feel free to peruse all of that. We're going to start here though at the prenatal care timeline. So this is what to expect at each visit. And on each one of these pages, just know that you can print using this print. Otherwise, it'll print like 16 pages. So just use our little button to help you print whatever it is if you want it to be printed out. But everyone on here has had their confirmation visit where we did the pregnancy test. You had your ultrasound with Taylor, and you met with one of the prenatal care team. Then you met with Renee Hall for your insurance and all that stuff, and you registered for this call. Things for you to consider and think about. Maybe start looking at if you need to use intermittent FMLA in order to be able to come to your visits. Then after that, you have a virtual appointment with one of the physicians. A lot of times it's going to be me, but this is where we go over your medical history, your pregnancy history, genetic history. If you need to see high-risk doctors or other specialists, then we arrange those. And I make sure that the labs that were initially ordered for you are appropriate for what I learn about your medical history. These are our standard prenatal blood tests. So we have lab transparency here, and this also tells you when you can expect to do certain things. So these are standard, these are optional. So when you talk to your provider after your confirmation, you all talked a little bit about the options for genetic screening. You have to be a minimum of 10 weeks to get some of these done, so that's why this is down in this box. And then we wrap up the first trimester roughly about 4 weeks after you have your confirmation. We have you physically back in the office to do your OB physical exam. The PAP test is not part of the prenatal panel because PAPs are every 3 years. So you might not be due for one. If you are due for one and you want to have it done, then you're welcome to get it done at the same time. But otherwise, cervical cultures are the only ones that we really need to get at the beginning of pregnancy. And if you need to see the high-risk doctors, they usually start seeing people right about the end of first trimester, unless your circumstances dictate something differently. A mental health screen. So everyone talks about postpartum depression, postpartum anxiety, but antepartum versions of those are real as well. And we like to get ahead of those as soon as we can. And once we figure out whether or not you are someone who could benefit from early support, perhaps it may be a good time to consider looking at doula care or doula support during pregnancy as well as during labor. And we'll talk about doulas a little bit more in a moment. Second trimester doesn't have a whole lot of things going on from a testing standpoint. There is an optional test regarding spinal cord abnormalities in the baby, which is blood work. The anatomy ultrasound, which I mentioned, is right about 20 weeks, 20 to 22 weeks. You're meeting with one of us around that time. We're going to start talking about your options for childbirth education, breastfeeding classes, because a lot of those are series classes, and we want to make sure that you get signed up and you have a chance to start and finish and have some time to review it before the baby gets here. A lot of your insurances cover breast pumps, and we'll go over that in just a moment too. This is a good time to order it. The glucose test, I may have some questions about that. Put a pin in it. We're going to talk about glucose in just a moment. But this is, if you pass the glucose test, this is your last blood work you have to do for pregnancy, usually. Yay! For my moms who have a certain blood type, we are making sure we have RhoGAM to give you between 28 and 30 weeks. This is when we want you to pre-register at the hospital. So there's a QR code at the front and in all the rooms that you can use to create your HCA portal. And if you haven't already, we want you to see the hospital. Third trimester, this is when it starts ramping up. So we start seeing you every 2 weeks. First time moms, you need to start looking for your pediatrician. This is when to start going out and interviewing people who may have the same philosophy as yours with regard to taking care of your little ones. Veteran moms, decide if you're going to stay with the same pediatrician because the hospital likes for you to have an appointment for your baby by the time you leave, usually within 2 days of leaving the hospital. Again, FMLA, this is a good time to start looking at your company's policy for leave, disability, and all of that stuff. If you have certain pregnancy complications, you start doing some additional testing. And for my moms who already know they're going to have a belly birth for whatever circumstances indicate that, we start looking at scheduling that when you're about 33 weeks. You'll see over here in the optional repeat or decline, it's the STI screening you did at the beginning of pregnancy. We need to do it at least once for the American College of Obstetricians. If you feel you're not in a high risk category to contract it during pregnancy, you can decline repeating it though. Around 36 weeks is when we start doing weekly appointments. And you'll see that we'll want you to bring in your birth plan after this because 37 weeks is full term. It is. Your due date is 40 weeks, but full term is 37 weeks. So we do one more pelvic exam for group beta strep, which will explain what that is and why it's important. And then if you opted out of repeating STI screening, that's also, you can opt out of repeating the STI cultures. Your natural cervical ripening methods we'll go through in just a moment. And then my belly birth moms are going to be getting off the train sometime between 37 and 39 weeks, again, depending on your personal circumstances. For those who are waiting on labor, waiting on baby to give the go ahead, first time moms, your average time of going into labor is 40 weeks and 5 days. Second time moms, babies usually come about a week earlier. So be patient, be patient. We do like all deliveries to be complete by 42 weeks because of increased risk of stillbirth after that. So 41 weeks and 5 days for first time moms, 41 weeks and 6 days for experienced moms. So again, remember all that stuff is out there that you can definitely print out. We have a list here of pregnancy safe medications. So on the left, you'll see an alphabetical list of common pregnancy discomforts. In the middle, you'll see some relief measures that you can take. And I think the midwives probably went over these things with you when you came in for your confirmation visit. But just know that you can also search by your symptom and see whether or not you have tried everything possible. Once you've tried everything on these lists, then it's fine to reach out to us and see if you need to try something prescription. But usually the first thing we're going to ask if you write in with one of those symptoms is, have you tried everything on the website first? All right, this is our diabetes screening. And I'm going to come back to this later, but I did want you to see that there are links here to other patient-driven options besides the drink that they have at the commercial labs. Some have been concerned about weight gain. I haven't gained very much weight yet. Some I gained a lot of weight so far. So how much weight should you be gaining during pregnancy? All of this kind of depends on where you start your pregnancy. So we can calculate our pre-pregnancy body mass index by putting in our height and our weight and calculating our body mass index. Hold on. But we should actually do it correctly. Hold on. You shouldn't be 50 feet tall. That's not good. So 5 feet, I promise that 6 is usually the highest I get. So our pre-pregnancy, our weight goes here. Reading is fundamental. And then calculate here and now. She's 26. So with the BMI of 26, she should be gaining 15 to 25 pounds. So what I really want to highlight though is that the weekly rate is in your second and third trimester. So second and third trimester should be gaining about half a pound to 0.7 pounds a week. And then if you have twins, you can add additional 10 pounds across the top of all categories. And these are general guidelines. Again, your individual health history also contributes to what is appropriate for you. Here we have our birth choices. So birth preferences. Do you want to wait as long as possible for labor? Would you consider a membrane suite? These are things you can talk to your nurse practitioner or your midwife about, whether you want to do these things ahead of time. What do these things mean? Do you want to wear your own clothing during labor? Do you want to do breathing techniques and use aromatherapy? Look through all of these. There's about 21 boxes on here, and most of you have more than 21 weeks left of pregnancy. But once you finish checking all the things that you want, then you can click print my birth preferences and it'll give you a worksheet with everything already placed in order with all the check stuff. After 36 weeks, you want to bring this in to talk to us about what to expect when you're in labor. Cervical ripening techniques. So these are things from evidence-based birth that you can start as early as 20 weeks. And some cautions for you, and you can see week by week what things we recommend to induce labor. And these don't actually put you into labor, but really they just kind of get your cervix soft and your uterus toned so that when your baby says it's time for labor, your body is more responsive to it. This is the box that I was talking about with regard to ordering your breast pump. We also have these QR codes in each one of our rooms that you can scan around your 20-week visit. Just put your information in here and they will write the prescription and send it back to us. Easy peasy. Next we have, hold on. Oops, next we have our, oh, here we go. Next we have first-time moms. How many first-time moms on here? And then how many moms do I have that had a C-section before and are going for a VBAC? Give me a heart or a thumbs up or something so I can just know. Do we need to spend a bunch of time on this? Okay, all right, you're out there. So first-time moms and trial of labor after cesarean tips. So many of you know I'm a VBAC mom too, and at one time I was a first-time mom as well. But these are things that we did in order to do what we could, control what you can, because babies are going to baby, pregnancies are going to pregnancy. And there's just not much that you can do about some things. But there are some aspects that you can do to know that you did everything possible in order to get the birth that you're looking for. So fear release, chiropractic care, pregnancy, yoga or Pilates, avoiding non-medical induction. First-time moms, y'all get real tired around 39 weeks and say, I just want the baby out. But just trust us and trust your body to know when your baby is ready to come out. If you have a little guy, you want to have him circumcised. We do those in the office, not at the hospital, until they're about 10 days old. And then if you are having if you're being induced for whatever reason, having a belly birth, there's information here for you as well. Naisha also sends it out on the portal. There's info here for after delivery. And then if you need to get records sent to us, like your operative report, or if sadly you're leaving, you're moving away, this is how to get records sent away. So just remember, all of this stuff is on the Full Circle Jack's website under the obstetrics tab. All right, we are going to go back to the presentation and talk about nutrition, because if we're worried about weight gain, we should be looking at calories. If you're saying, all I'm doing is drinking coffee, I don't understand why I'm gaining all this weight. Is it coffee or is it a salted caramel mocha monstrosity? Did you know that pregnancy only requires an additional 300 calories per day? It takes 10 calories to maintain a pound of body weight, and your goal, as we saw, is based on your body mass index. So if you're starting the pregnancy at 170 pounds, it takes 1,700 net calories to maintain that. If your goal is to gain 25 pounds, you get 250 extra calories. Enjoy. Divide that between breakfast, lunch, and dinner, though, that gives you 650. And if you eat 650, you can't drink 570 to wash it down, because your baby does not know the difference. So don't drink your calories. This is a little more in depth on where those calories come from. So percentages of what comes from carbohydrates, what comes from protein, what comes from fats. And then this one actually just shows us how little changes can make a difference. So if you're trying to cut back sodium or keep your sodium down, just going from traditional spaghetti sauce to 20-minute herb-infused marinara can cut 500 milligrams of sodium per serving. And that's a big deal when your rings start swelling and you can't get them off. So you want to eat your fruits and veggies, your whole grains and cereal. You're not going to give your baby an allergy to nuts or dairy, so enjoy. My coffee drinkers, you just want to keep your caffeine at less than 200 milligrams daily. If you are a tea drinker, these are the herbal teas that we recommend in pregnancy. So raspberry leaf, as I mentioned before, ginger, lemon, and peppermint. If you are vegetarian or pescatarian, you want to be sure that you're getting an adequate amount of protein. There are some pregnancy diets that recommend taking 100 or 120 grams of protein a day. That is a lot for pregnancy. You will probably grow a 10 or 11 pound baby. 70 grams is plenty to keep you and baby both growing at a normal rate. You can have deli meat. Just be sure that you microwave it for 30 seconds. It does not have to be piping hot and fresh out of the microwave. You can let it cool, but just the 30 seconds is required to kill any harmful bacteria. And then if your soft cheeses are made with pasteurized milk, they're fine. If you can't verify it by flipping it over and looking at the label, then skip the brie for the evening. Your canned tuna, you can have up to 3 4-ounce cans per week. If you're a pescatarian and need to know which fish you should eat more of, because some are high in DHA, which is good for baby's brain development, which ones are kind of neutral, so they're kind of plus or minus, and which ones to avoid because of methyl mercury. The FDA has this nice document that this is the latest iteration, October 2021, about which fish are good for pregnancy. Whatever fish you eat, be sure you cook it all the way through so that yummy ahi tuna is not for you during pregnancy. Sorry, sushi lovers. Your steaks need to be well done. Ugh. So no more yummy medium rare and medium steaks. For my kombucha drinkers, my kimchi eaters, sauerkraut, all the fermented kind of things, moderation or limited, just because the fermentation process, obviously, fermentation is how we make alcohol. And so also stay away from alcohol because we don't know when, like in what trimester fetal alcohol syndrome occurs or how much alcohol it takes in each individual person to make it happen. You also want to keep your sodium under 1,500 milligrams a day. So remember that herb infused marinara? It's looking real smart right now. Any questions about food before we move to exercise? Right, crickets. All right, exercise and pregnancy. It's fine to continue whatever exercise you were doing prior to pregnancy. I'll give you some things to be careful about at the end. Just know that in the beginning you're going to be tired. Everybody's tired. Second trimester, you'll get some physiologic changes that will accommodate more aerobic activity. You increase your blood volume, your oxygen tension and saturation. So just listen to your body. If you weren't doing anything prior to pregnancy, it's okay to start a new regimen. Doesn't have to be anything crazy, but just know that sedentary lifestyles lead to malpositioned babies. We want baby's head to be down, yes, but we also want face to be down. So a lot of babies are now settling so that their backs are toward your back, and that is the opposite of what we want. That's our highest risk for C-section. If you're trying to avoid it, don't be sedentary. If you have these little cute Fitbit watches that tell you what your heart rate is all the time and create new reasons for anxiety, just know that your resting heart rate is going to go up by 10 to 20 beats per minute. That's normal. That's physiologic. That is okay. If you're not getting lightheaded or dizzy from it, it's fine. If you're walking for exercise, be sure that your heart rate is in the aerobic zone. So that's 70% of your maximum heart rate. We get your max heart rate based on your age. So if you're 30 years old, you should not be exercising with your heart rate above 190 for prolonged periods of time. 70% of 190 is where your aerobic zone starts. So if you're walking, your heart rate should be between 133 and 190 for 30 minutes, 3 times a week. That is exercise. If you're walking and your heart rate is still between 80 and 100 like it always is, that is transportation, which is also important, but it's not aerobic exercise. So what aerobic things can you do? All the cardio, take your pick there. If you're lifting weights, you can continue lifting whatever your pre-pregnancy weightlifting amount was. You don't need to increase your resistance as your baby and your body will do that throughout the pregnancy. Squats are my favorite. Please build up to a minimum of 50 per day. So if you're already squatting and you do more than 50, carry on. Love it. If you're not squatting yet, at 20 weeks, you start with 5 a day. 21 weeks, give me 10 a day, and so on until we go up over 50. Pilates and yoga are also two of my favorites. So you're just thinking anything that opens that pelvis and makes those muscles long and lean. And any experienced instructor will be able to tell you what the pregnancy modifications are. Things you want to watch out for. High intensity interval stuff after first trimester. So it's not the interval, it's the intensity. Just those sudden jerking movements can shear the placenta off the side of the uterine wall. So do the low impact version of these. Anything that has you lying flat on your back for prolonged periods of time, like excessive ab work. You can do standing abs, side lying abs. Hot yoga, unless you're a hot yoga instructor and are fully acclimated to that environment, you will get dizzy and you may fall, and we don't want you to pass out on your belly. Scuba, changes in barometric pressure reduce oxygen to the baby. Obviously not a great idea. Same thing with high altitude hiking. When the air is thinner, there's less oxygen. Contact sports, please do not take up kickboxing during pregnancy because if someone kicks you, that would be awful. Outdoor biking after 16 weeks isn't a no. It's more of a be careful just because your center of gravity changes around 16 weeks. And as you try to turn those corners, you may find yourself falling all the way over instead of really hitting that corner. All right, we talked about nutrition, we've talked about exercise. Now we're going to talk about the glucose test because the glucose test, we screen everybody who has a placenta. So if you don't have a placenta, then I don't have to test you for this. But your number one risk factor for gestational diabetes is not your family history, it's not lifestyle, it's not weight. It is your placenta. It's how your body reacts to hormones given off by the placenta. So the placenta tells your insulin to not do its job. And insulin is supposed to be clearing your bloodstream of glucose to bring it into the cells and use for energy. If insulin doesn't do its job, it leaves glucose hanging out there. Extra glucose in your bloodstream is diabetes, but it's diabetes because your placenta, the hero and supervillain, is making it so. So for my moms who say, but I never eat anything that has sugar in it, you eat good carbs. So your fruits, your whole grains, don't avoid those in the days leading up to the test because you'll get a false positive on it. We do have the Simply Pure drink here in the office. We now have the Fresh test here in the office. That slide that I showed you before from the website that had the patient-driven options, you can see on there what we sell and how much it is. But just know that our Fresh test price is a lot less than you'll be able to get. We get it wholesale. So it's less than you'd be able to get it for online. Preparing for birth. Childbirth education classes are not just for people who want an unmedicated delivery. Everyone needs to breathe, and a lot of these actually center on different breathing methods and different positions to get into during labor as well. So these represent hypnobirthing, hypno babies, Bradley method. There's a bunch of different things on here, but if you start looking for, like, Google any of these, again, this is for informational purposes, you will find that the algorithm finds you and it will start sending you childbirth education classes. For breastfeeding classes, HCA, if you go to their website, again, it says just register for a class. Go ahead and click that. They have Sonia there as our lactation consultant, and she's fantastic. You can even see her after you deliver. You can come back to the hospital and see Sonia, and your insurance covers it. So just know that that's a thing too. Every new parent needs to know CPR. There are some private independent instructors, some lactation consultants who also teach CPR, so community stuff is out there available too. But here's a link to the Red Cross. If you're already seeing a chiropractor, good for you. Just be sure he's sure they are Webster certified because that's a special certification that adjusts, no pun intended, for the changes that your bodies make during pregnancy and to make sure that their adjustments are safe for you and for your baby. So give me a heart if you're planning to work with a doula or a thumbs up, just so we know how many people, because we're going to be talking to you about doulas as well throughout pregnancy and just asking, especially based on what your goals are. So what is a doula? What are they there for? I have a midwife, a doctor, a nurse practitioner, a nurse, all these different people. Doulas are there for emotional and physical support before, during, and after pregnancy. So helping you remember your breathing techniques, getting in different positions, relaxation strategies during labor. And again, not just for people who don't want an epidural. Sometimes it's the emotional support. Remember the mental health screening that we are doing too. That's where your doula comes in. She's not giving you medical advice or providing medical care, but she's helping you process your feelings about the advice or care that you're receiving from us, possibly helping you formulate questions in order to better communicate with us, or coming with you to your visits or FaceTiming into your visits to help facilitate conversation if you feel like you're having trouble expressing or your questions. Ask the midwives and the nurse practitioners and physicians for recommendations for doulas. We can tell you who we've worked with over the last 12 years and who we've seen support our moms the best. Pregnancy acupuncture and massage are both amazing and highly recommended by us. If they need a letter, let us know, and Naisha will be happy to provide that for you. Breast pumps, we've already said the QR codes are in the rooms, but also if you forget or lose that, you can go to our website and it takes you directly to the same site. For those who will be using the Family Medical Leave Act, in order to take off time for your baby, we contract with a third-party company called Leave Guru. And if you've ever tried to get these forms done before, they can take like 2 weeks or more to get them completed. And a lot of times you finish them and then you don't even deliver on the date that you put on there. So you have to go back and get them done all over again. Leave Guru eliminates all that issue, and a lot of these forms are done within 10 minutes. You definitely less than 24 hours in most cases. So Kylie will help you get that together as well. After you deliver, we don't just toss you aside. We want to keep taking care of you because the postpartum period is full of a lot of emotional and physical ups and downs. So, moms who have any issues with their blood pressure during pregnancy, because once again, the placenta, the hero and the supervillain. The placenta can also give off hormones at the end of pregnancy to make your blood pressures go up in order to shoot more blood to the baby. That's good. It's doing its job. It's bad for you. Your blood pressures do not need to go up high. So first time mamas, 1 in 8 of you is going to have an issue with blood pressure, and you've never had an issue with blood pressure before. It's not because you're tired from running in or exhausted or mad at your family. It could be the placenta. If you have any blood pressure issues, we're going to see you back in the office sooner than before, even if you have them in the hospital, because the most dangerous time for preeclampsia is actually the first 14 days after you deliver. So preeclampsia isn't just prenatal. Postpartum preeclampsia is sometimes worse than preeclampsia that you get during pregnancy. My belly birth moms will be back at 2 weeks for us to take a look at your incision. We also do routine mental health screening after delivery. So 80% of you are going to have what we call baby blues. And baby blues are that kind of tearfulness and sentimental feelings that you get in the first couple of weeks. That is very normal and common. If it doesn't wear off after the first 2 weeks, we might be starting to look at postpartum depression, anxiety, or rage. And again, we want to get ahead of this. Postpartum doulas can also help you screen for some of these feelings. They are just angel people who will come to your house for a fee and take over your nighttime feedings so that you can get some sleep. Because sometimes it's not postpartum depression, anxiety, or rage. Sometimes you just haven't slept in 3 days and you need to. The Motherhood Space is an awesome resource in Jacksonville. We're one of 5 pilot cities for a grant that takes care of moms and from a mental health standpoint. It's a collaboration with the YMCA and one of the former psychologists at Downtown Baptist. They have light therapy, yoga therapy, exercise therapy, group and individual counseling, all covered by the grant or insurance. And so if you qualify for that, we'll place that referral. On-site childcare for babies 6 weeks to 12 years of age. It's an amazing resource. And then pelvic floor therapy. This is pretty standard at 8 weeks after you deliver. Everyone is at risk for pelvic floor discomfort, leaking urine, pain with intercourse, all the things that we don't really talk about after a baby passes through, or even after a C-section where you carried a baby on the weight of your pelvic floor for several months. We have a nurse who comes in 3 times a week, so it's done here at Full Circle, and Tracy will do electromyography and biofeedback to help you put things back as close to where we found them as possible. These frequently asked questions, you can sleep on your left, your back, or your right. If sleeping on your back makes you dizzy, get a wedge pillow from Amazon, stick it under one hip so you can't roll completely onto your back. You can help paint the nursery. Just be sure it's a well-ventilated space or you're wearing a mask. Probiotics, prebiotics, postbiotics, you can take all of them. Hair dye, yes, including your eyebrows. I had that question before. Gel nails are also fine. You can travel in a car. So car travel is fine, but after 37 weeks, again, remember your full term. So if you're going to be traveling far away, remember your baby doesn't have a calendar and doesn't know that you're not near Full Circle, which is where you want to deliver. So just be sure you're getting out and stretching every 2 hours, though, if you're taking long trips over the summer. You can continue the use of urabenzyl peroxide, salicylic acid, anything topical except for retinol. Bakuchiol, Bakuchiol, is a good alternative for topical retinol. And flight is fine for twins up to 32 weeks, for singleton pregnancies up to 36 weeks. Just please, please, please wear your medium compression hose, drink lots of water, and do your toe raises to circulate your blood so you don't get blood clots in your legs that lead to your lungs. No roller coasters, no water slides, no jet skis. That's it for your FAQs. So upper respiratory illness update, which is current as of right now. ACOG moved from strongly supporting either way to recommending boosters in third trimester. If you're getting COVID specifically, Moderna and Pfizer are fine. We don't recommend Johnson & Johnson because of its independent risk of blood clots. So if you're planning to get boosters for your vaccines, they're usually done early third trimester, so you have time to make antibodies to pass during breastfeeding. So if you're more than 6 months past your Moderna or Pfizer, you can get Johnson & Johnson because mixing and matching, or don't get Johnson & Johnson. You want to get, if you're 2 months past Johnson & Johnson, you can get Moderna and Pfizer because mixing and matching is okay. And there's no optimal timing against the flu vaccine, RSV, or Tdap. We don't give them here in the office, but if you need prescriptions, you can get them at any Minute clinic and we can send a prescription for you to get them. If you do get upper respiratory infections, there are no recommendations for these medications. Our recommendations instead are for not coming in here and infecting all the other immunocompromised pregnant people. Please convert to virtual appointments. Start your vitamin D3, your zinc, your vitamin C. If it's COVID specifically, we do recommend baby aspirin because it has been associated with increased risk of gestational hypertension. If you're wondering why everybody has gestational hypertension now, it's because some years ago everybody had COVID. And then serial growth ultrasound specifically to COVID because of the increased risk of high blood pressure. You only need to go to the hospital if you're having difficulty breathing or a fever that you're not able to bring down with the appropriate amount of Tylenol. For those who had your last baby, if you're a veteran mommy, you had your last baby during COVID, deep breath, it's different now. We're back to our 4 visitors in the room. So for anyone who's laboring, you can have 4 visitors in the room. If you have a doula, she's not considered one of your 4 visitors. So you have 4 and a +1. We're not routinely masking in the room or in labor unless you are actively positive for some contagious upper respiratory infection. And even if you have it, we don't separate you from your baby. We give you an isolate to protect baby from your respiratory droplets and give you N95 masks so you can still continue to breastfeed. All right, so we are social. Follow us on all the things because we will actually be posting some stuff soon. I promise. It's been a year. But just know that we are out there on all of these different social mediums. So not one single question all the whole time. I saw some hearts and some clapping, so I know y'all were listening. But thank you for joining me this afternoon. I appreciate your time. I appreciate you choosing Full Circle. If at any point your experience here isn't living up to what you expected, don't go to Google or Yelp. Go to me. It's my practice. I started it, and I can help you resolve what the problem is. Okay. The question I have here, just for clarification, how many in the labor room? So 4 visitors plus 1 doula. Excellent. All right. Well, y'all have there's another one. No maximum on heart rate for exercise. Well, only because of your age. So I imagine you're all probably more than 0. So 220 would be it. So for me, I shouldn't be exercising with my heart rate above 170 nowadays. The question here, is that the same for C-sections? How many visitors? So for belly births, you can have one person in the room with you plus your certified doula as well. Good question there. Okay, any other questions? Y'all are just holding them all to the end. I appreciate that. Okay, well, doesn't look like we have, never mind. What about taking a cruise? How many weeks can I cruise up to? So the cruise lines actually set this, and they say no more than 24 weeks. So if they find that you are pregnant, or, because I think you have to certify or tell them that you're not or whatever. If you tell them that you are, they're going to ask for a letter from us, and we will we'll certify what your due date is so that they know that it's okay. Question here, is it okay to go to the Caribbean? Absolutely, go ahead. We're not currently under advisories, I don't think. There was a warning about Zika in Central America, but nothing recent. Can you still have the patch for nausea on a cruise? Yes, so the scopolamine patch is safe in pregnancy. Sounds like somebody's got a cruise planned. Is lemongrass tea okay? Bring in the one that you're talking about because there are some that have additional additives that are not okay, but the lemongrass by itself is not the issue. And then is Emergen-C okay? Yes, Emergen-C is fine too. Y'all really were saving all these questions until the end. I was just getting ready to disconnect. All right, I'm gonna give y'all a few more minutes. Okay, what about chemical relaxers? So nothing proven that chemical relaxers are harmful to a pregnancy. So we don't have any, we don't say that you cannot get your hair relaxed during pregnancy. All right. Okay. Is it possible? And at what point can I have a letter that I can't work 12-hour shifts if I'm struggling to do so? So that's something you want to discuss at your individual appointment, because those are usually disability accommodations or FMLA, and that's something that we have to have a chart note certifying that we discuss what your specific either disability, because pregnancy by itself is not a disability. But if you're having an issue with the pregnancy that prevents you from working a 12-hour shift, then we can write accommodation letters for that. The sodium and electrolytes still needs to be within the sodium limits too. Yes, yes, definitely. Please don't take too much sodium. Your body will absolutely let you know that. You'll start swelling. When do we start to feel the baby move? First time moms usually start to feel around 18-ish weeks or so. Veteran moms usually start to feel a little earlier, like 15 to 16 weeks. Is it true you can get a handicap sticker for pregnancy? Yes, it is true. You can inquire at the front desk about that. We have forms and a process to go through that. If you're having a boy and planning circumcision, do you require vitamin K shot? Yes, we do. The oral drops are not a substitute because, again, they go directly to the baby's stomach acid where they don't get absorbed. So the vitamin K shot is required for the circumcision. Just know that we do have preservative-free vitamin K standard on formulary at our facility. Okay, rapid fire. Can we record the belly births? Not the actual birth part, but once the baby is out, then you can do short videos then and go over to the warmer and do videos there as well. There are some doulas, because even as I say that, I know there are doulas who recorded some really cool twin portions of a twin birth. We had to get special permission for that. If you're high risk, does that automatically mean you have to have a C-section? It depends on what your high risk issue is. Next question, can we record our vaginal births? The hospital policy is actually against recording vaginal deliveries. Still waiting. I'm ready. Man, y'all did have questions. I'm impressed. Okay. I think we met. Nope, never mind. Can baby go straight to skin, or does it need to be assessed first? We usually go straight to skin. For vaginal deliveries, we follow the full arc of delivery right onto mommy's belly. So our goal is for baby to go skin to skin. The only person who usually messes that up is the baby. If they don't come out crying and breathing, then we do have to have them assessed first so we can get all of that going. The next question is, can we watch our own belly births through a clear drape or mirror? We actually do have clear drapes for belly births. You can't see the actual belly birth happening just because of the logistics of your belly being in front of your face. But birth photographers are permitted in the OR, and so birth photographers can take a series of still shots for you if you want to, commemorate the belly birth. That's a good question. I don't think anybody's ever asked that one. All right. Anything else? What symptoms should we watch out for? Well, that's different throughout pregnancy, but in general, bleeding like a period. Um, as you get later on in pregnancy, large gushes of fluid, anything that could indicate that your water is broken. And then as you get even farther in pregnancy, there's a certain amount of movement that we expect from your baby every day. So as you go to each visit, we'll tell you, oh, you're 16 weeks, you should watch for this. You're 20 weeks, you should watch for this. 24 weeks, because it does change. Can we eat during labor for VBAC? So it's just the same as a regular labor. You can intake clear liquids throughout labor. What I recommend usually is things that give you good energy. So electrolyte drinks and honey are great for VBACs and for regular labor too. Because sometimes when people go into transition, they get very nauseated and whatever they took in comes back up. So I tell people you can have what you want, but just make sure it's something you want to see again. And honestly, if you're really in labor, it's fight or flight. Your body doesn't want you to eat large portions. You're not hungry, you're just thirsty and you need some energy. If I have bad allergies, can I take Benadryl, specifically the blue congestion kind? That's on our website for For congestion, yes, Benadryl is one of the approved medications as well. Is there a way to avoid having strep? That's something you'll want to talk to your practitioners about because there is a group beta strep protocol that you can do toward the end of pregnancy. It's a bit involved, but it involves garlic and garlic suppositories, but you have to continue doing it until the baby comes. So the short answer is there's a way to reduce your risk significantly, but the longer answer is it's a longer answer. How long do food aversions last? I'm struggling with picking food. That's different for everyone too. Usually people are okay with by their 14th week. All of this first trimester ickiness is gone away. And can we have kids stay overnight in the hospital? Yes, siblings are welcome to, siblings have 24-hour visitation, except during, I think, cold and flu season. You'll have to ask on the tour, the NICU people to be sure of this, but I think that siblings are always welcome for visitation, but staying overnight, you'll need to ask the NICU. There are some restrictions during the flu season and RSV season as well. Actually, this has turned out to be the most number of questions I've ever been asked on a webinar. If I'm unable to drink enough water per day due to nausea, should we try to get IV hydration and infusions? Yes. If you are, if like, because going to an urgent care costs $10 million now. But if you want to go to one of those IV hydration places, Naisha actually has a letter with the additives that are okay in pregnancy. So just write to one of us and we can get the letter to you to take with you to the IV infusion place because they won't give it to you if you're pregnant and without a letter from us. Anything else? All right. Like people are like, are you still typing? I feel like every time I start talking, somebody is so it's just because someone's typing. Oh, there it is. At how many weeks will my colostrum start coming in, and can I pump when it does? So I usually don't recommend pumping until you are full term. So after 36 weeks, because pumping can start contractions, and we don't want to throw you into preterm labor. If you can't make it to the birth, I am unlikely to be at the birth because remember, midwives. So if you can't make it to the birth, who would be next to help? So you'll have a midwife who is there, who is in the hospital at all times. And that midwife you'll meet at the beginning of her shift, as midwives work 12-hour shifts. So you'll meet her at the beginning of her shift and she will be there and she'll tell you when she's leaving. So if now there are times that I do take call, but it's not as many times as there are midwives there. So you'll get a chance to see. I mean, sometimes it's you, I don't know how many midwives you've already met here. But Jordan, Jackie, Norma, Lauren, there are a lot that you will meet, and then there are some that are our hospital crew. Can I give birth in another position other than back? If you read our pregnancy birth preferences, yes, you will see all the different positions that you can get into for labor. So I encourage you to go through all of those on the website. The short answer is yes, and you can see what other positions are available out there on the website. All right. Okay, this one just says thank you so much. So I think we might be at the end. You're very welcome. Thank y'all for being thoughtful and intentional with your questions. I can tell y'all were really paying attention. I appreciate you. We'll look forward to seeing you all back in the office really soon. You guys have an amazing evening. Take care. Bye.